So I think COVID is affecting spine patients first in having people, when we were in the real height of the pandemic, at least here in New York City, people did not want to understandably come to a hospital, didn't want to come to a hospital in the city. And I think people in general, and perhaps still, are neglecting their overall health problems because all they have is telehealth. Not that telehealth isn't fantastic, but they're less likely to take care of things that are everyday things they would have previously taken care of, but now because of COVID, they're not taken care of. And what ends up happening is it can build up. It can build up when they're not doing their preventative health. As for the spine, I have not really seen directly in my patient population, because mostly I see surgical patients, so I haven't seen patients who have problems from being on the computer too much because they're doing only things on the computer in isolation. But I will tell you, I can guarantee that isolation will cause increased depression, and that will lead to increased pain for whatever the underlying disorder is that may be provoking pain in patients. So I expect that to be a bigger problem. I am a huge fan of telehealth. If we're talking about telehealth, I think it has made such a positive impact. It was one of the positive things that have come from this COVID crisis. The reason I say that is we can do so much in terms of initial evaluations of patients by having the appropriate imaging study, being able to interact with them face to face, even if through a computer screen, and even examine them with limited facility through telehealth. And it is so nice for patients who would have previously had to drive an hour, pay for parking, wait in my waiting room, and then drive an hour home or more, to be able to gather the information ahead of time, not be anxious about exposing themselves to the outside world or to other people who may get them infected with COVID or something, and to be able to sit in the comfort of their home and get the diagnosis. To me, that's the positive of telehealth. And honestly, if you said, well, tell me the negative, I don't see a big negative, except that it may prevent people from getting help they need to have face-to-face. But I think if we tell patients, this has been great, but I have to see you, they will still come and do the visit in person that they must do. And I'm a believer that for most things, I'd like to see them live once before, if they need surgery, before we subject them to surgery.